Dr. Gaia Pecorelli of the Italian Health Foundation Initiative in Milan will tell us about the keeping fit through a vaccination, building the ABC of an healthy lifestyles, an Italian experience to strengthen cross-sector collaboration, something you have heard also from the Honorable Minister today on the ABC of the lifestyle and the combination with vaccine. Gaia, you have the floor.
Chairman, ladies and gentlemen, good afternoon. I want to thank the Ministry of Health and IFA to the pleasure and honor to present at this important conference on behalf of Healthy Foundation. Healthy Foundation is a non-profit organization that promotes and contributes to the development of scientific research, training, information, and assistance in regards to physical and mental health, welfare, and the environment. The main objective of HF is health prevention through the promotion and education on lifestyles, including vaccinations. By entering vaccination in an integrated concept of prevention and lifestyles, we can deliver to the young population the concept that vaccination are part of the health and welfare of the citizens. They are included in the process of primary prevention of communicable diseases, avoiding later in life important and more severe situations. In order to make the vaccination idea appealing, we combined it with concepts like physical exercise, healthy food, so nutrition, and favorable environment. Vaccination were presented as a milestone in the history of public health, just as it happened with drinkable water. And we explained the history of vaccination as a curious and intriguing stories that would catch the adolescents' attention. As an example, the story of Jenner, Pasteur, and Sabin were presented to make the talk more lively and catchy. Going through the vaccination calendar, we introduced the concept of best timing to perform a vaccination, explaining all the reason behind such a choice and the general principle of performing a vaccination at the proper time with respect of the disease. We presented vaccination to be performed at the age range of the students in the classroom, so rubella and HPV. The rubella vaccination allows us to discuss about the possibility of a virus causing malformations during pregnancy, and the anti-HPV vaccine allows us to discuss about sexually transmitted diseases. And we could show the HPV burden of disease and why this vaccination is not only for girls, but boys as well, allowing us to present the concept of universal vaccination. Particular interest was shown regarding the anti-influenza vaccination and the population clusters that could highly benefit from it, thus allowing us the introduction of concepts such as frailty, sarcopenia, and aging of the population. The presentation about vaccination was performed by MD residents. So in a few words, young doctors attending School of Specializations from different local universities within two regions, Lombardy region and Veneto region. The plus of such an approach is the following. Young physicians get along well and are better accepted by the students. They have a natural better interface with the generation only 15 years younger. They are, by definition of their status, updated and scientifically sound. They include this project in the credits of their study plan. And last but not least, their performance is practically at zero expense for the system. So basically, they volunteered. The idea of involving young medical doctors is a double win for themselves, becoming educators, for the youngs and for the students through their empowerment and knowledge of health literacy, which is one of the main goals of the European Commission, as we heard this morning from Peter Wiesner and many others. Our project is called 10+, 10 being the highest grade you can get in the Italian school system. We've involved 45 middle schools from 5 cities in Lombardy and 4 cities in Veneto. Once we've established the schools, we met with the school principals, the teachers, and a group of MD residents in order to explain and plan the lectures. We've created a great group of young physicians who come from different residency programs, mainly within the University of Brescia and other local med schools. At the end of the lecture, we always allow much time for questions, curiosities, and stories, and distribute an end of the project questionnaire to see how much students remember from these 2 lectures. We also gave out booklets, as you can see on the slide, about the topics we just discussed. This map shows all the regions in Italy, and the red stars represent the Lombardy and Veneto regions, so where the project is taking place, and the green stars represent the other 7 regions where our project will be done very shortly. The results of this project can be summarized in high interest both by students and teachers, high appreciation both by students and doctors, excellent feedback by the teacher who actually asked to repeat this experience the year after, appreciation by the families, and about the vaccinations, we had an increase in the anti-influenza vaccination rate in the students' families and an increase in the anti-HPV vaccination rate and request of vaccination for boys, which is not yet covered by the Italian national health system. So all this is raising an important question. How fast is an health system in responding to the request of the population when a preventive measure scientifically sound and validated is available and not yet offered by the system? So medicine is obviously progressing faster than government's decisions, but coordination within each country and among EU state members is at most importance. What I presented to you is one of the many projects of Healthy Foundation. This particular project could be of help in your strategy of vaccination, and therefore we offered it as a template at the European level, thus involving the European university system and in particular the European University Association. EUA will be discussing this opportunity following my presentation. Thank you.